340B impacts clinical decision making, which this one
I know
really frustrates me. So why don't we talk about that?
Yeah, it's another line in the CBO report. I'm going to get it wrong, but something about like that the 340B program might inspire people to purchase more expensive or prescribe more expensive drugs, which just like is so offensive to me as a proud supporter of the community health center program. There is no physician at a community health center program that is going to let the price. That's not why they work at community health centers. Like let the price of a drug dictate what they do. And I think that their responsibility as community health center providers is to do what's best for patients who are oftentimes in a really difficult spot. They would never risk somebody's health to make $10 extra for the health center. And I've never encountered a health center where they're even giving those instructions to providers, even if the providers would follow those instructions. It's never, ever come up. So, and I can only speak for community health centers. Those are the covered entities I know the best, but I just don't think that should be part of the conversation, that we would ever think that physicians would make decisions for patients based on the bottom line of their entity. I just think there has to be data out there to contradict that, or I'll go get it.
No, I mean, but I think that's right. I think, and we're going to talk a little bit about the need for greater, transparency and data. But I just want to reinforce what you're saying, that like most of the providers that I have spoken with, be it recently or over the course of the last 2 decades, like they're not thinking about 340B and how that's coming back. They're thinking about the needs of the patient.
Right.
That's literally the only thing driving their decisions.
Right.
And quite frankly, when you look at our patient population, it's doing the best that they can for them. Because the lack of access or all of the other barriers that exist in terms of how they're accessing. So that's a tough one, but I appreciate you taking it on and putting that one to rest.